denominators, if I were to look at between, it doesn't matter where the traffic victim comes from, are going to be the personal factors, which is the person has been abused as a child, has been raised in typically, families without social support. In this country in particular, child welfare system is becoming a breeding ground because, again, that vacuum is what you go back to. There's heavy recruitment within child welfare, and they are nowhere close to being ready. They have now, the state of Florida has 3 laws that require the child welfare workforce to be, to be prepared. We have MDPs, multidisciplinary teams that basically come together, make the case plans. They find alternatives, they find services for these victims. It's mandated, but Florida is leading in the country right now when it comes to child welfare. Other states need to come on board. Safe harbors, we follow that. But yet, the number of individuals who have been approached for trafficking is very high. We know within the child welfare system, abuse is very high.
This is kind of a branch off question of that as well. You're talking about Florida legislation. I know that there have been some things in the works about requiring human trafficking education in schools. Do you have any updates on that? Do you think that's going to go into effect soon?
So, I'm glad you asked that. So the health department as well as the education department are coming on board with the state anti-trafficking, the council. And they are trying to mandate a few things. Having said that, in Florida, as you know, the school boards are independent, right? School districts are independent of each other. So there is only so much that you can regulate in terms of mandate, that this is mandated that every school has to have it. That's not how it works. So it would be upon us, or people who are in the human trafficking field, to actually approach each school district and convince them unless we follow the same route that we have so far, which is it trickles down. So first the policy is made, then laws are made, and then we are following. That's not the route you're going in this one. It's still agencies trying to approach school districts, and school districts approving the request of including that in the curriculum or not. But yes, I have heard the talks, and there is will, there's political will as well. I haven't heard anything in opposition of it yet. So let's hope so.
Okay.
I really hope so.
Yeah.
I'm a firm believer that, the first responders are the ones who can make a difference in this field. It doesn't matter who it is. Is it a pharmacist? Is it some emergency room staff in a hospital? Is it school teachers or counselors in schools? Is it the TSA staff? Are these individuals working in the airport, the bus drivers, the motel, housekeeping staff? So these are the first responders, because these are the ones who are going to see it happening and report. So if there is no report, then you can't move forward, right? But in cases like, so for example, I'll tell you some efforts that I've tried reaching out to Lee County in the past, and the issues due to which they find it difficult to accommodate curriculum related to human trafficking is that teachers are overworked. The issue is not that there's no will. Their argument is that you find money and people who will do this work. We will give you space in our current schedule, but we cannot afford to give our teachers or add that one extra thing. The same with child welfare. The caseload is very high, so unless there is legislative support, financial support, or third-party organizations will find support to do that kind of work on, and that follow-ups are extremely important.
Yes.
It's not a one-time deal. So that's when I think the change will happen. Having said that, where is the data? And data is the weak link in human trafficking. Research and data are not anywhere close to where we are in terms of research on even child abuse, even related other, domestic violence. This is an upcoming issue of underground population that you're trying to study. What the U.S. Attorney's Office is trying to do is to create that missing link, right? Which is to create a database based on which we will be able to better understand what is going on in our areas.
Mm-hmm.
Once we understand that and we have that kind of data, we can actually go out, if you want to, people like me want to do research, then we can go and show the data to SAMHSA or whatever and say that, okay, well, you know, there's a real need to do research to understand the population that we are serving or we are expected to serve that we don't have. Indirectly, once there is a trafficked victim within the community, so you know what happened with the Fort Myers High victim, right?
Yes.
The person has gone through a life of enslavement for X number of years. You have rescued that individual. That individual is going to be coming back to the community, right?
Mm-hmm.
So that process, in the process, if there is no sensitivity or understanding of what the person has witnessed or gone through, right? Not only you are, as a society, what should I say, looking at it from a different lens and impacting that one life, but think about the family members that had to deal with that individual, the friends of the person that had to deal with that individual. At a larger scale, there are mental health consequences, right? So the person who was a former victim of trafficking is now working with, let's say at McDonald's or at whatever job it is, right? Now, are those individuals aware of what happened to this individual? Are they aware of the health issues that the person has dealt with? Are they aware of the mental health issues? Because they are going to see, when the episodes happen, right? The anger, the outburst, you are going to witness those things. So so that's the other issue. So how do you create a healthy community where there's inclusion, right? There people from diverse background, including victims who have suffered immensely, are looked at in a very positive light. So that's a big challenge. Like, I've had students who have undergone something close to trafficking, not trafficking, but sexual assault and other things that I'm aware of. But you see that there is a lot of rejection in the community when something like that happens. So that whole lens needs to shift, because instead of shaming the victims, you need to start thinking about caring for those victims, and that's when you will be a healthy community. So first of all, just this crazy myth of it's never going to happen to me, it happens in Mexico and it happens in Asia, and that's a big myth. It could very well be you. In fact, the number of documented cases that we have in Florida, the highest number that we have is domestic, right? We have international labor trafficking victims, but sex trafficking victims are, our community, our kids from our community. So there are, in terms of impact, there's financial impact, there's social impact, there's cultural impact. Most of all, there are health consequences that we need to be aware of. A lot of the times they get hired in industries that do not have the right training, right? And that's where we have the re-trafficking occurring from. So that's the other piece that the agencies will have to take up. That, okay, well, so re-entry is really into the communities. That is a really big, I think honestly that's the elephant in the room, never been noticed. Because we do have victims. Now we are good at rescuing. We are also decent at learning how to work with them within our own close boundaries. What we don't know is how do you prepare communities to embrace these victims and make them heroes. So we had a conference, the Antidote Conference, this year over at FGCU, wherein survivors came and talked about issues. In one of the panels, the question asked them was, what has changed since you came out in open and said that you were trafficked, right? These are all survivors. They have done wonderful with their lives after being rescued, and they have really revived themselves, so to speak. But unanimously, right, the entire panel of survivors, what we heard was slut shaming needs to stop. The taboo does not go away. So there's a trauma about coming out, right? And that comes from the community. That does not come from anywhere but the community making it. The worry is not, in my opinion, the worry is not as much how do you save the community from the bad world of trafficking, but the real worry is how do you prepare the community to embrace the heroes who have survived, slavery.